switch gears once again.
Okay.
Talk about the upcoming flu season. Last year,
Yes.
the big buzzword was H1N1.
Mhm.
Where do we stand this year with what's coming up?
Well, historically, we know that pandemic flu viruses tend to remain in circulation in the community, but at much lower levels, and probably because more people have been exposed to it and have immunity, so you see it in fewer numbers, but it's still circulating. And that's the anticipation we have with H1N1. Fortunately, it is now part of the standard seasonal flu vaccine. So if you get a flu vaccine this year, you will be covered for the 2009 H1N1. It also covers another strain of influenza A and H3N2 that we have seen circulating in the southern part of the United States, and so no reason to think that it won't be here eventually. And then it also contains protection against an influenza B virus. So every year the seasonal flu vaccine contains protection against 3 different strains of influenza, 2A and 1B. The lesson that we learned, and we learned a lot of lessons from H1N1, but one that we learned last year was that the average age of hospitalization was 37. And 90% of the cases of hospitalization and death occurred under the age of 65, which is complete reverse of what we see with seasonal flu vaccine or flu virus typically. So since we know that's going to be circulating around this year, I think it's a good idea for people, just because you survived last year and didn't get it, doesn't mean that you won't necessarily be exposed this year and get it. So everyone should get the flu vaccine. One thing of interest too that they've noted, and I don't know that this is an official statement yet, but one thing that has repeatedly been identified on studies, that for whatever reason for 2009 H1N1, people that were obese tend to have a higher risk for hospitalization and death. So that now is something that we're encouraging people. If they're overweight, just again, you may be 30 and overweight, but still get your flu vaccine. So that's a new recommendation. The CDC is really pushing anybody over the age of 6 months should get a flu vaccine. No reason not to get it unless you have an egg allergy or some other serious contraindication. You can talk to your doctor about that, but most people can tolerate that. The exciting news, I think, with the flu vaccine this year is that as we get older, our immune system doesn't work as well, and so we don't find typically we have the same immune response to a stimulation like the flu vaccine. And so what we found with a lot of people as they got older, if they had the flu vaccine, they could still get the flu, but they just wouldn't have as bad an outcome with it. Well, this year there's a new product that's going to be marketed called the high-dose Fluzone. And what it is it's a influenza vaccine, same Fluzone that you can get. I think it's Sanofi. I'm not sure who the manufacturer is. I don't want to say, but I think it's Sanofi. But it's the same flu vaccine, but it has 4 times the antigen in it, and it's the antigen that stimulates your immune system. So the idea is that, well, if we give you a little more punch in there when we give you the vaccine, it's going to stimulate an even better immune response and provide even higher levels of protection. Now, the long-term studies haven't been done. We know it's safe, but the long-term studies haven't been done to really look at the efficacy. So as far as the CDC is concerned, they make no particular recommendation. But from a biological standpoint, it sure makes sense. And that's available for people over the age of 65. And I'd encourage people to really think about that, because it makes sense that you are going to have a better immune response. So that's something new and exciting, and if they do find that that's effective, it may be even something that we use for people that are 40 and diabetic, or something like that, if we know that, and maybe use it for people that we know may have a depressed immune system. So I thought that's kind of exciting, and maybe something to talk to your doctor about. If you fit that age category, talk to your doctor about getting that vaccine.
Okay. Are there any problems with supply anticipated this year? I know last year was kind of unique, but...
No, I haven't heard of anything yet. That doesn't mean it can't change, but
Sure.
I think they anticipate having enough vaccine for everybody, and again, they're recommending it for virtually everybody over the age of 6 months. One thing that's a little bit different this year that you might hear from us that's a little bit different, our flu season in Allen County and Indiana in general is generally in February and March. And so I'm usually telling people, why don't you wait till about October to get your flu vaccine so you make sure you have full protection for that whole flu season. Well, this year, because we had, I think I told you that H3N2, they've seen some outbreaks in the southern part of the United States. We're really recommending that as soon as your doctor, or you can get it at the farm, I've seen it now with the pharmacies, as soon as you can get it, you should get the flu vaccine. Then the question is, well, should I have a booster then, say January or February? You don't need to have that. The CDC is saying that 1 flu vaccine per year is all you need, unless it's your first in your child. But as an adult, one flu vaccine that should cover you for the whole season. So that's a little bit different. You'll be hearing John and I saying that we want you to get vaccinated as soon as you have access to the vaccine.
I know last year with the H1N1, one of the things that probably you do as a commissioner and your department does is probably a lot of planning for contingencies, for emergencies. How did the whole process go with you guys? I mean, you're coordinating with different hospitals, media outlets, things like that. I mean, how did it all go? Any lessons learned?
Well, actually just came back from giving a talk on that, on the lessons learned, and a lot of good lessons, but just briefly, we had worked with our community for a long time in planning how we would respond. What was interesting is we had done several drills, had all planned on how we would do it if we got all this vaccine and needed to get the shot in people's arms at the same time. What we realized is that's not how we were going to get the vaccine. After all that planning and drilling, that's not how it came. It came in 500 doses here, 1,000 here. But our staff worked very hard on that. We would look at the decisions for every shipment we received. Half would go to doctors' offices and hospitals so they could vaccinate their staff and the high-risk patients, and then half we would provide at a free clinic we offered at Carew Center. And we had that clinic open for 4 months, and we offered free vaccine. We did prioritize to the high-risk groups for about the first month, but after that, anyone had access to it. The interesting thing was, as soon as we had enough for everybody, nobody wanted it. And that's something I think that our community as well, that was a national phenomenon, so it's not just our community. We need to kind of work on that a little bit. We need to take advantage of preventive measures when they're available, especially if they're free. We need to really, there's a lot of good science out there about vaccines. There's a lot of misinformation about vaccines, and for every one website you go to, you want to make sure you balance that with going to another website that gives you challenging information. But at the end of the day, I put my faith in the Advisory Committee on Immunization Practices. I put my faith in the Centers for Disease Control and Prevention and the Institute of Medicine, and they recommend vaccines. But, we didn't do a very good job of taking the vaccine as we probably should have. So one of the lessons learned is we need to do a better job at making sure people can sort through all the information they're hearing and really arrive at a decision that helps their family stay healthy. One of the things we did really well was actually with the media. John had coordinated a community-wide media approach. We had our show, our live television show, where we had PBS and all of the other stations came together, and PBS produced it. We were able to get a lot of good information out to people in real time. They all heard the same message. We were able to work with our hospitals and our healthcare providers so that we were all approaching the situation in the same way in terms of recommendations for triage, and our hospitals worked together to implement visitor restriction policies at the same time. So I think from a community standpoint, we all did a really good job. I think the media did a good job in letting people know what's going on without alarming people, which there was no need for alarm with this particular virus. And so I think that's good that we didn't run around like, oh, H1N1, they provided information so people knew what to do. We did a really good job, and we're very grateful to our colleagues who helped us reach out to non-English speaking folks. That was really, I think, a real plus. So I think overall our community did a really good job in responding. The only thing I would say is, maybe our vaccination rate should have been higher. But other than that, I have no complaints with how we handled that. The interesting thing is most people had no idea how busy things really were. But most of the hospital ERs were running at about 180% capacity for several weeks. Doctors' offices were inundated for several weeks. But they did a good job. They were still able to get the folks vaccinated that would take the vaccine. They were able to minimize absenteeism from work and from school. Our school nurses did an outstanding job in making sure when kids were symptomatic that they were excluded so they didn't infect others. We didn't have to close schools. We didn't have, employers having real problems with absentee rates. So again, I think our community as a whole did a good job.
Okay. Anything else that you want to talk about or get out there?
I can't think of right now, but maybe in the future, some things that we want to talk about are fall precautions. We're seeing a lot of falls in the elderly, so that would be a good topic in the future. We're forming a community-wide task force to really look at that. Prescription drug abuse is another issue that our community is facing. We're not alone in these issues, but we want to. And one of the things that really made me feel good was that when we had a prescription drug task force group together, and we were talking about how we can approach this and stuff. One of the members there had been on the H1N1 triage task force, and the reason he said he wanted to come to this was because he saw how well a community approach works to dealing with a complicated problem like that. And I thought, that really is the way it should be, that we should be working together, and so everywhere I go I hear the same message. I have the same things done to me. You know, if you go to Dairy Queen, get whatever you want. But when it comes to important health message, everywhere you go, we should say the same things. And that really was a real testimony to me when that doctor said that, you know, that is the way to approach things. It makes it easier for everybody. So we're going to take that approach and deal with some of the really important issues that people come to us about. And, you know, and those are great things we'd love to share with you. Because it all, at the end of the day, gets back to the public. And they need to be educated, and they need to make informed choices, and that's what we're all about.
Sure. Okay.
So that sounds good.
Well, thank you for your time.
All right, great.